Hi, this is Jenny from Real People of the Sunshine Coast, and today we're at MEDIFARM. And joining me is Adam Benjamin, founding director of MEDIFARM, and they grow out here medicinal cannabis. And Adam's about to tell us all things relating to that. So, first question for you, Adam, is tell us about MEDIFARM, how you got started.
Sure. Well, look, thank you. That was a lovely introduction. But really, we started MEDIFARM. I started in 2015 to help Aussie patients with medical cannabis. Back in 2015, we were having dinner with one of our close friends, family on the Sunshine Coast, the Martins, and their boy passed away. Sam, who was a beautiful boy, passed away from terminal cancer in 2014. And I learned that towards the end of Sam's life, he was helped with medical cannabis, and I just vowed then that when the laws changed in Australia, we must help Australians with highest quality regulated medical cannabis treatment. So that's what we're here to do, and that's why we started MEDIFARM.
And you and I were chatting earlier at the Health Incubator earlier in the year, and it fascinated me to know that there's actually, I guess, people are ill-informed about cannabis, and there's a lot of different strains and genetics. Could you just elaborate on that for me?
Yeah, look, it's a good point, and I think the easiest way to understand medical cannabis compared to any other types is that there are genetics that are purpose-bred for medical conditions. So although we're standing amongst many plants here and they probably look identical to all your viewers out there, really these are specific genetics that are bred for conditions like epilepsy, or separate genetics bred for chronic pain, or separate genetics bred for cancer-related nausea and vomiting. So it's very important to understand, I guess, that the medical cannabis genetics are bred and backed by clinical trials for specific health conditions. Unlike, say, recreational, which most people know are bred for very different reasons. But people do understand, and I think people are obviously, they're clever to understand that the genetics that are bred for certain conditions is where that we really stand apart. So really we are talking about prescription cannabinoid medicine written by a doctor, dispensed through a pharmacy, as another excellent tool in the doctor's bag.
And there are a lot of stages in the process, from obviously having the seedlings right through to the mature plants. If you had to summarise what you were doing that's innovative, aside from the whole concept, is there anything in particular?
I think what's amazing when you talk about innovation is, and I like to think about how, it's all well and good that we may be kicking goals, but how can the region, how can the Sunshine Coast capitalise on such a fabulous industry such as medical cannabis? So when you talk about innovations, it depends what you're looking at. If you want to be a farmer and understand the innovations in what you can see here, which are some of the farming systems we're using in the greenhouse, some of the growing systems we're using, you can do it if you're already a great farmer and want to step into this space. But if you're not a farmer and you just happen to be an excellent, say, pharmaceutical manufacturer, you can also step into the medical cannabis space. As a producer, as the first fully licensed producer in Australia of medical cannabis, we have a duty of care. We're in the business of helping patients. We just happen to be fortunate to be able to help many industries along the way that we draw on and we hopefully give back to as well. We've seen all along, as part of our licensing, the people we come and ask to work for us have to come with very thorough background checks firstly, but obviously we want professionals. We don't want to have to teach somebody how to be a farmer if we need them in our greenhouse. We want the best farmers, and we upskill them in the farming of medical cannabis because we've got a license.
So would that be an opportunity for, say, a lot of the Queensland cane farmers that are going, this is not worth it for me anymore, that perhaps they're an excellent farmer, they're looking for opportunities, that's perhaps they should be having a coffee with you or a conversation with you to see if that's something worth exploring for them?
Yeah, absolutely. We've now completed 2 harvests, so what you can see here, the guys are now replanting for our 3rd season, and every time we harvest we put that away so that when we come to market, which is what you're talking about, in about 3 months with prescription medicine, there'll be enough. We know at the moment the Federal Health Department estimates that there's upwards of 200,000 Australians who are still seeking medical cannabis but through other channels, and at the moment there are only about 10,000 Aussies every month being prescribed this, and we know part of the solution is the local supply chain. So we want to ensure that as we build up reserves and as we supply to the market, that there's never a time where we say to a patient who is hopefully getting benefit from our products, but we never say to them, I'm sorry, can you wait 2 weeks while our plants grow? We must have a continuous high quality supply.
If this plant here has produced, and from every plant you can supply on average 2 people for a year, that's correct? But you can track that back. So when it ends up in the bottle and it goes to the patient, you can track it back to that plant.
Absolutely. So the fancy word for that is what in pharmaceuticals, they call it pharmacovigilance, the standard to which you would expect your medicine produced, be it any medicine you receive in Australia, is a very, very high standard. Actually, as it turns out, Australia's got the highest standard. We have the same standard as those in the US. And so from a business perspective, this gives us just an unbelievable competitive advantage because of what Australia already does well in, But when you talk about tracking these plants, it's very important to be able to not only produce this high quality medicine, we have on-site laboratories that will then be able to say that this bottle of medicine was grown by this plant, and this plant grew through various stages of our company, so that the if you like, the quality can always be ensured. We've been very fortunate. We formed an exclusive partnership with the global pioneers, the first ever medical cannabis company in the whole world, which originated from Israel. And they're a company called Tikkun Olam. Tikkun Olam translates to heal the world. They set up a culture of research first, prove first, and make money later. So what happened in Israel with our partner company about 15 years ago, as the first, they said to their government, we will prove that this is a medicine. And they were receiving patients come through the government's approval that were finding one plant would be better than another plant for a certain condition. One patient who had cancer was finding more pain relief from one plant over a different one. So the Israelis, being very clever, would study more about that plant, and they'd breed it naturally. They'd keep breeding until they got that genetic just right for the treatment of cancer. Now, these genetics do not just float around in the world of medical cannabis out there at large. They are owned by the Israelis, they are developed by the Israelis, and we have the exclusive rights to them. We can say to doctors that want to work confidently in this space, here is a 15-year track record with all the clinical trials, with all the patient data, so that if you're a specialist out there right now listening, and let's say you're an oncologist, a cancer specialist, and you understand that maybe this can help with nausea and vomiting with a patient who is going through chemotherapy, or it might stimulate their appetite better than other things. If you're an oncologist, you can understand that although you may be stepping into this the first time in your world, it's 15 years of history, of protocols working in this space, and I'm not a doctor, but I know that we've got plenty of doctors in our family. They're smart. They work with their colleagues. They work with their peers so that you can gain more knowledge.
So we can expect to see, I guess, more of this on the Sunshine Coast in the future.
I hope so.
But speaking of the Sunshine Coast, why did you decide to set your factory, your premises, your manufacturing plant up here?
Well, aside from us living here in the Sunshine Coast is unbelievable. It's awesome. And my wife's family's 4th generation here, so why wouldn't you live on the Sunshine Coast? It is where really good agriculture meets really good healthcare. So at the beginning when we started this process, even to me, I thought, well, that's a little bit like a sales pitch. But it turned out right. And that's not our doing. That's a $3 billion health precinct, and we're blessed with this sort of weather. So the farming opportunity was already there, and this is the sweet spot where good agriculture meets good healthcare.
That's fantastic. And a final question for you. For other entrepreneurs, irrespective of what industry they're in, or people looking to relocate their business to the Sunshine Coast, what would you say to them?
Good idea.
Look, Adam, thank you so much for chatting to us today. You've been an absolute delight to talk to. I'm walking away so much more informed than I was before. Thank you so much for your time.
Pleasure, and thank you very much.